This conference will now be recorded.
Good afternoon. My name is Monika Jones, and I'm the visionary founder of the Brain Recovery Project Childhood Epilepsy Surgery Foundation. I'm really pleased to welcome you to our very first town hall. We should have been doing these for years previously, but we have not. And this one's a little bit different in terms of its format because it's not live. As you can see, I'm still working from home, like so many of you are there, and my son should be getting off of his bus in about an hour, and I hope that I'm able to finish at least this first portion of our town hall before the bus driver knocks on the door. What I thought we would do is go over the history of the Brain Recovery Project and get a discussion of our strategic plan and let you know how we're doing in terms of moving our mission forward to serve all children after epilepsy surgery and help them reach their full potential. Oh, sorry about that. How did we get started? It really came from what I would say a moment of pain and frustration that I had when my son was in the ICU after his anatomical hemispherectomy. And that was a surgery that when he was 3 years old, what many people know who are friends with me is that Henry's actually had 3 hemispherectomy related procedures. The first one, he was just 3 months old, a hemispherotomy, which stopped his infantile spasm. So this is a photo of him there on the left after that surgery. And I asked his surgeon at the time, you know, what am I going to do with this baby that has had half the brain disconnected? How am I going to help him walk? How am I going to help him learn how to talk? And he said, you know, we really don't know. Just get a lot of therapy. And he was one of the finest, most renowned neurosurgeons in the area of this surgery. And he really didn't even know what we would do with the kids after to help them thrive. My son's seizures came back. We had a revision surgery and seizures came back again. I learned very quickly how difficult a journey this is for so many of our parents, especially those whose kids require multiple surgeries. Also, how challenging it is for the surgeons. Even the best surgeons in the world don't have 100% success rate after some of these surgeries because, as my surgeons described Henry, he was a very difficult disconnect. The brain was so deformed, the connections were so difficult to see, especially when they're very young. And during this time, he lost all his words, my son did, and has never spoken again. But after that second surgery, we knew we were going to need an anatomical hemispherectomy, and we spent a month in the ICU. And you get a lot of time to talk to your surgeon when you were spending a month in the ICU. I'd see him every day. And I dare to say that we became friends at that point. And at one point I said to him, you know, why don't we start a nonprofit to fund research around how can we help these kids reach their full potential? How do we get them to walk? You know, their neuroanatomy has changed so significantly. You've completely disconnected the corticospinal tract on one side, which has implications for mobility, just to start. And we met at his home and we decided to start the Brain Recovery Project in 2011. And so this is just a little kind of peek at our history. Today is May 11th. It is officially our 10-year anniversary, so happy anniversary to us. And in August, we got our 501c3 status. So May 11th is when we became a corporation in California, and in August, we got our 501c3 status. And we had a very narrow focus there at the time, which was really to inspire and fund research to develop neurorehabilitation programs for children after hemispherectomy. It took us a few years to get off the ground. First, we had to raise sufficient funds to pay for a chief scientific officer at the time that would help us map out the type of research we wanted to do. And then we had to raise funds to actually fund the research, and that takes time. In 2014, we received a grant from the National Institutes of Health under their R13 mechanism to host a conference where all we did was talk about neurorehabilitation after hemispherectomy. What's the potential of one hemisphere of the brain? Can the children learn how to read? What does the research say about reading? It was very narrow, but also very informative because, again, it told us really there's very little that we know about these children after surgery. We may talk about what the children do in the social media groups that we have of all the parents that are discussing these things, but the research is really very sparse. There's really very little of it. And so that's kind of what we teased out at that first workshop funded by the National Institutes of Health to really, kind of know where are we in terms of the state of research. We raised sufficient funds to start a camp at Rancho Los Amigos National Rehabilitation Center for children in the chronic phase of recovery after hemispherectomy, meaning they were several years out after surgery. They had to be able to walk or at least bear weight or take a few steps. And we put them on robotic devices to see if we can improve their gait and their hand function after surgery. And that camp has gone on until last year was the first year we did not have that. We had it every year since 2014. Sometimes we would bring the kids back to see if there's a second dose of rehab that would help. And it really grew to be this wonderful program where we learned not only do the robots help the children, but being in that camp-like environment with other kids that are just like them was also very powerful for those kids to see that they're not alone. There are other children that have the similar challenges that they do. We raised sufficient funds, about $152,000, to also fund a camp or a research program at the Center for Cerebral Palsy Research out of Teachers College in Columbia, at Columbia University, to better understand whether hand, arm, bimanual intensive training could improve the function of that hemiparetic hand. At the time and still today, there's only one research paper which discusses the efficacy of constraint therapy in children after hemispherectomy. And that one paper only talks about it in terms of one child. We know from the broader research around constraint therapy that for kids who have a massive injury to the corticospinal, to the motor strip on one side of the brain, that they tend to recover less hand function than those that don't have such a massive injury. And after hemispherectomy or hemispherotomy, you've either disconnected or removed one motor strip of the brain, which is about as big an injury to that motor strip as you can get. For that reason, we were really interested in habit because, first of all, you use both hands. That's what most of us do. We use both hands, not just one hand. Putting a cast on the hemiparetic hand, as they do in constraint therapy, can be very challenging for a child, especially if they're younger. It can be very frustrating for them. But also, we know from the other research in children with cerebral palsy or after stroke that if there's been a massive injury to that cortical motor strip, that recovery of function is going to be really difficult. So we started the habit camp for several years to understand, is using both hands together a better way to approach that hemiparetic hand function. We started a research program out of Caltech at their Emotion and Cognition Lab because we wanted to understand adults who had surgery in childhood who have normal cognition or normal IQ, whether they have challenges, memory impairments, processing issues, that even though they have a normal or average IQ, that it might still be challenging for them, and that would be informative both for teachers and for parents and anyone else working with them. That is an imaging study that we've had and neuropsych study that we've had at Caltech and Travis Research Institute out of Fuller Theological Seminary that works very closely with the Emotion and Cognition Lab. And that research has also gone on for several years. And the New York Times published an article about it, a paper that was written out of this project because it was so fascinating how well the adults were doing after having hemispherectomy in childhood, but also how their single hemisphere of their brain was really working extra, sort of in overdrive, to make up for some of that, the lost hemisphere. When we started to have some data collection and early research out of the Brain Education and Mind Lab in Boston to understand how children after hemispherectomy read, whether they can read, how they do it, And then ultimately, we'd like to understand what we can do to improve their function. So that also started in 2014. That was a big year for us. And finally, we started some autism data collection. There are some surgery, in particular hemispherectomy, who may have autistic-like characteristics or diagnoses of autism. But why is that, and how many kids have that, and is it effective, to have that designation in the IEP, for example? That might help. In 2015, we started to put up what's called knowledge translation summaries on our website, and these are guides that will help educators or families understand some of the outcomes after hemispherectomy and some of the challenges. Vision after hemispherectomy, really difficult to explain to teachers, for example, what homonymous hemianopia is like and what the interventions are for homonymous hemianopia. So we have a great knowledge transition guide up on our website about that. The same thing around cortical auditory impairment or central auditory impairment. If you remove or disconnect a temporal lobe of the brain, you're going to have difficulty processing sound. So we put those up as well. And then we also have a translation guide, knowledge translation guide around educational issues, something that the parent can hand to the education team at school to help them understand the common impairments a child will have after surgery, but also that there's a really broad spectrum of outcomes after surgery. Many of the children do learn how to read. Many graduate with a regular diploma after high school. Many go off to college. Some even have graduate degrees. And it's important for us to make sure that educators also know how to work with these kids. And by the way, all these years are conference years. We're supposed to have one in 2021, but it's been postponed because of COVID. So while we're doing all this, at the same time, we're also having our family conferences originally hosted with the Hemispherectomy Foundation. And when they decided to do those conferences more, we stepped in and took over those conferences and have been doing them since 2015. In 2017, our team really noticed that it's not just the community of children who've had hemispherectomy that need attention, where there's really not a lot of research around how you can help them reach their full potential, but it's really the entire community of children anywhere on the epilepsy surgery journey. There are barriers to getting them prompt referral to epilepsy surgery evaluation. Many parents don't understand, when is it time for me to start thinking about epilepsy surgery for my child? And according to the research, that's after 2 failed appropriate medications. So we decided to change our mission from just neurorehabilitation after hemispherectomy to serving children anywhere on the surgery and helping them reach full potential. Active for us in our conference. We started of other organizations. I went to the Epilepsy Society meeting, Network, the Epilepsy Leadership Council, on ways that we could collaborate together to move our mission forward, but also to help those organizations in their missions, Tuberous Sclerosis Alliance, LGS Foundation, around helping them understand epilepsy surgery for their population. We also started to think about a registry for our kids. At this time, nobody is really tracking how these children do post-operatively. And we started to see themes in a lot of our social media groups around hydrocephalus, for example. A lot of parents talking about early puberty after surgery, but that wasn't being captured anywhere. And I think you all know doctors don't like it when we say, hey, I heard on a Facebook group that early puberty is actually a thing after surgery. If they don't have the data, if they don't have the published research around it, I think a lot of them look at us like we're crazy. And so we started to work on a registry where we would capture the patient experience through parents in a registry and then start tracking those outcomes until the kids are 18. So we worked really hard on that, and that was finally launched in 2019. 2017, we also started an advocacy program where we would give one-on-one assistance on IEPs, as well as a surgical evaluation travel scholarship. So to break down one of those barriers to getting a child to a prompt epilepsy surgery evaluation, we have to break down the barrier of the financial challenge that it is to travel to a facility far from home, to get in a hotel, to airfare, all of those things that are associated with that. And the surgical evaluation travel scholarship helps with that. 2019 was another really terrific year for us. Again, another conference year out of the Cleveland, where we had teams from Sick Kids Toronto, UPMC, the Cleveland Clinic, Rainbow Children's, all over the place, come speak to our families, and collected a lot of data around literacy and vision. So learning how to read, how these kids read, how they do in academics, as well as how they process vision. And we also launched our Global Pediatric Epilepsy Surgery Registry, where parents will enter how the children are doing after surgery. You know, do they walk? Learn to have IEPs and how to talk in school. How many parents regret surgery? What are your concerns about challenges? In 2020, of our scientific advisory board, one member of our community advisory council, and then our board and staff to build a new strategic plan that would better serve the community of children anywhere on the epilepsy surgery journey. And I'll talk about that in a little more detail. This year, we launched the first report from our registry, which you can see on our website. And we've got a couple of other really interesting things that I'm going to talk about in greater detail in the upcoming slides. Let's talk about our strategic plan. How did we even put one together when we met in Chicago in 2020, just before COVID hit? Well, the first thing we did was we released a community survey to all of you where we asked you a lot of questions, how you used our website, what kind of information you wanted us to have, what you were experiencing as parents, and what you wanted us to do. And you can read that community report on our website, but I've captured here just a couple of points from that. 52% of parents are experiencing emotional distress over the child's medical challenges. That's a really powerful statistic. I think that we all know from working with each other or being at the conferences together or in social media groups that there are a lot of parents that are lost. They don't know what to do in terms of the number of seizures the child might be having preoperatively or a lot of the medical challenges postoperatively. So we knew that one of the things that we had to do was address the issue of emotional distress that the parents are having, and part of this would be through education, not only of our parents, but of the clinical community. Only 40% of you believe that your child's medical providers are knowledgeable about the child's medical challenges. That's a low number. Again, that told us we had to help educate the clinical community about all of the things that you're seeing even after a successful epilepsy surgery. 71% of you report that your child has some form of a learning disability. What that tells us is that we need to continue with the education content that we have on our website, with the guides, with the webinars, so that you can better advocate in school. So that conferences might have to be have a richer, deeper content around managing behaviors after surgery. 30% of you are concerned about estate planning, long-term planning. My son is 14. I'm certainly starting to get worried about, what we're going to do for him as he gets older. And 21% of you believe that healthcare providers know what to do to improve your child's function after surgery. That means almost 80% of you said the doctors we work with, the therapists we work with don't really know what to do to help improve our child's function after surgery. So what that tells us is, again, we need to fund more research around that. We need to frame research around that. And then we need to go back to the clinical community to help them understand what to do. Here are kind of like the three big things that you asked us to do for you in that community survey. 63% of you, this was the biggest number, want us to hold conferences, workshops for the doctors to tell them what our families are experiencing, as well as how to care for children after epilepsy surgery. And this really surprised me because I thought it would be something more related to what you wanted us to do, in terms of education or IEPs or something like that, because that seems to be our sweet spot. But you really said to us, you know what, we're distressed over how little the medical community knows about our children. So please go back to their conferences, these medical conferences, and help educate the doctors. And we're going to do that, and I'm going to share how. You want us to increase funding for research. I understand that, but you want it particularly on how to improve outcomes after surgery. So this means research that is not primarily around understanding outcomes, but what we can do from an interventional standpoint to improve those outcomes. And then you wanted us to really expand our research resources around transitioning from childhood to adulthood. So we hear you. When you say that these are the top three things you want us to work on, we hear you. And we built our strategic plan around these, primarily around these three things. All right, let's talk about the strategic plan. We're not going to get through the whole strategic plan in this town hall. We're going to look at it today, as well as in town hall part 2. But the first 4 parts of the strategic initiatives, the first 4 strategic initiatives are around what we called child impact objectives. And these are initiatives that will directly impact the child. First, you want us to help parents. So first, again, we had this meeting, and again, using the data from the community survey, we decided we're going to help parents and aligned stakeholders. So this means doctors, physical therapists, anyone working with your child, educators, understand the medical and functional outcomes after surgery. Medical would be things like whether the child has precocious puberty, whether they develop hydrocephalus after surgery like hemispherectomy. And then functional outcomes is, do they learn how to read? How do they learn how to read? How long does it take them to walk? That kind of thing. We're going to focus on improving medical and functional outcomes. So again, not just understanding outcomes, but improving them, improving educational achievement, and also improving that transition into adult life. So let's look at the first initiative, understanding medical and functional outcomes. We launched that registry in 2019 and had the first community report in 2021. Take a look at it on our website. It's short, it's not data from the entire registry, but we're really able to start to capture a lot of the things, again, that we've been talking about in social media groups that doctors don't see. One thing is endocrinopathies after these big surgeries like hemispherectomy. What's an endocrinopathy? That's some sort of disease of the endocrine system. And the big one that we see is precocious puberty. In 2020, I presented an abstract at the meeting of the Endocrine Society. This is the very first time an issue like an endocrinopathy has been discussed in the research literature after any type of epilepsy surgery. Now we're working on a research paper around this, and we're also going to have a conference, which I'll tell you about in 1 second, around that. So again, you asked us to understand what happens after surgery and then report it back to the doctors. So the registry helps us understand that many children have early puberty. We also published an abstract at the American Epilepsy Society meeting this year, which looked at speech and cognition after hemispherectomy for hemimegalencephaly. This is a tough etiology. This is my son's condition, and I remember when you first get that diagnosis, you get that poor prognosis. The children don't do very well. They need this surgery. They have intellectual disability. They're probably never going to learn how to read. Our registry has captured that this is not true. Now, my son does not talk. My son does have an intellectual disability, but many children do learn how to read, and many children, the parents report almost an average or a normal cognition, some reporting a normal cognition or average cognition. And so this is the first time that speech and cognition has ever been looked at in the research literature. And not only did we publish a paper about it at the American Epilepsy Society meeting, but we're also going to publish a research paper that clinicians can understand. The second community report from our registry will be published at the end of this year. We'll have more data in the registry at that point, and we'll have a much broader, deeper registry report to all of you. We also have a lot of research around understanding medical and functional outcomes. We published a paper in 2017 around what parents report their child's vision is after surgery, hemispherectomy. What that told me, that is about 10% of you don't understand that your child has a homonymous hemianopia, which means that the education also needs to go back to the parent. Clinicians, frankly, are not doing a very good job of explaining what a homonymous hemianopia is to many parents, so we want to improve that. At our 2019 conference, we gathered a lot of data. You may have participated around what your child's visual function is after surgery. And one paper was published in 2020, which showed what some of that function is. And we have another paper in the pipeline out of Carnegie Mellon University, Marlene Berman's lab. She's wonderful. She really enjoys working with us, where all of you who participated in that vision research, that research will be published soon to show how your children process vision after big epilepsy surgeries. We also did a lot of academic data collection at the 2019 conference, particularly around reading, how children after big surgeries read. And I'm very excited to say that this year, 2021, that paper has finally been, actually it's the data from the 2017 conference. The paper is about to be published, and then we're going to prepare a knowledge translation summary, not only for you, but for teachers who work with your child, to help them understand what assessments need to be performed for children after surgery, and sharing with them the data of what the challenges are with reading, so then that they can better develop interventions in school to help your children learn how to read. And then we also continue with data collection around the study of adults who had surgery in childhood and their cognitive processing. So again, you asked us in the community survey to report back to parents and back to doctors about what we learned. So we always report back to you at our family conferences, and we do this in the sessions when we invite the researchers we work with to share their data collection with you and to present on a topic. Can always go to our website for our knowledge translation guides, and please, please, please make sure you subscribe to our YouTube channel, because we have something like over 100 videos from all our prior conferences where we're giving you the information that we've learned. I'm part of I work closely with Perkins School for the Blind to make sure that teachers of the visually impaired and orientation and mobility specialists understand our children. I did a webinar for them so that their TBIs and other vision educators could understand homonymous hemianopia after surgeries which remove an occipital lobe. And I also work with them in their CBI collab and was part of their new CBI Now launch of that website, to give the parent perspective around these epilepsy surgeries, especially those that remove an occipital lobe and remove a homonymous and cause a homonymous hemianopia. So be sure to go to Perkins School for the Blind for that information. I've also given a talk at the Association for Education and Rehabilitation of the Blind and Visually Impaired around epilepsy surgery, so that those therapists who work with your children in school, or maybe in a vocational rehabilitation once your kids become adults, also understand these epilepsy surgeries. And I'm really excited to share a medical conference that's coming up Again, you asked us to go back to the doctors and report about what we're learning in our registry. And this year, a workshop proposal that we prepared for the American Epilepsy Society, very happy to announce it was accepted. And I will be presenting along with Dr. Taylor Abel, who's the head of pediatric epilepsy surgery at UPMC Children's Hospital and is also on our scientific advisory board. Scott Perry, who's the medical director of the Neurosciences Institute at Cook Children's Hospital, who's also on our scientific advisory board and head of the steering committee for the Pediatric Epilepsy Research Consortium. Mary Lou Smith, who's very involved with the International League Against Epilepsy's neuropsychology working group, and is in clinical practice at Sick Kids Toronto, which is a big epilepsy surgery facility in Canada. The four of us will be presenting a 90-minute workshop at this year's American Epilepsy Society meeting on the functional and medical outcomes after pediatric epilepsy surgery. Things like the endocrine issues you all see after surgery, the incidence of hydrocephalus, the importance of these children being tracked on an annual basis, even into adulthood, because some of these things can creep in, and then some strategies for managing parental expectations. Again, this is a very big deal for this community. I'm so glad that you pushed us in the direction of going back to the doctors to share with them what we're learning, and we've successfully submitted this workshop proposal, and we're going to be able to do that this year. I'm really excited to do that. I hope we can do that live too. Okay, the second strategic initiative that we have around child impact objectives is improving functional and medical outcomes. That's challenging. First, we have to understand what the outcomes are, and then we have to fund research to improve those outcomes. So that's what we're doing with our we did with Habit Camp. That's what we did with RoboCamp. That's what we continue to do on an ongoing basis. We've developed that body of research around learning how to read after a big surgery like hemispherectomy. So now what we need is interventional research. What interventions will help a child learn how to read after surgery? So that's why I say academics is coming soon. That paper that's going to be published soon about academic issues after surgery, and then how to improve them. So that's what we want to work on funding after. I'll talk to you a little bit about the new scone device. And then again, we have a conference coming up where we're sharing what we've learned on improving outcomes at RoboCamp, as well as with Habit Camp. Oh, let's start with this. Sorry about that. So this is something we funded this year. We provided $25,000 in funding, not for the research, because the research really is already there out of the Edgerton lab at UCLA. We're funding the production of a device that is non-invasive. It goes on the spine of a child who's, or outside of the skin, on the spine, on the back of a child, and provides them with e-stim in the spine. And look at this little boy. He had hemispherectomy 2 months ago. This is the very first time he's trialing the device. And you can see how well he's walking there on the right. Improvement in his foot positioning, improvement in his step. We have very, very high hopes for this technology. And so we've provided $25,000 to the new corporation that's creating these devices for use in our population, to see how these kids do using this on a regular basis to improve their gait and positioning of the foot. We also think if the device is placed higher in the spine, that it may improve hand function. So that's, again, a non-invasive transcutaneous spine stimulation that we've provided production support for. Okay, again, improving function. We submitted a symposium proposal this year to the American Congress of Rehabilitation Medicine, where Dr. Cynthia Solorio at Kennedy Krieger Institute will present data on whether acute inpatient rehabilitation after hemispherectomy results in better mobility after surgery. Believe it or not, there's no research which says Should these kids go into inpatient rehab after surgery? We don't know. She now has the data on it, and we're going to present this at the ACRM symposium in September. Dr. Susan Shaw is the Assistant Chief Medical Officer at Rancho Rehabilitation Institute, where we have RoboCamp. She now has years and years of data on whether the robotics intervention, the camp-like environment of PT and OT improves function in children that had hemispherectomy years ago. We have data to show that it does, and that was what will be presented at ACRM. And then Dr. Andrew Gordon, who is head of the Center for Cerebral Palsy Research. Again, that's the habit hand-arm bimanual intensive training that we've funded over the years. We finally have enough data and an upcoming paper where we can now present a symposium at ACRM, and this is where all the physical therapists, the neurophysical therapists, the physiatrists come to learn about therapy interventions. And I'm very excited to share that we'll now be presenting neurorehabilitation after hemispherectomy. It's the first time this has ever really been discussed at an ACRM meeting. So again, thank you for pushing us in that direction. The third child impact objective is improving educational achievement. And if you know anything about the BRP, you know that we have a ton of education content on our website. We've spent years building the research around reading. Can a child with hemispherectomy read? Does a child with hemispherectomy read like a child with dyslexia? They don't. We figured that out. And the paper that's about to be published is how does a child read? They all read differently. And what that paper will say is it's very important to assess the child to see how that child reads, what their strengths and weaknesses are. You can't just say, well, they've had a hemispherectomy, therefore they're going to learn like this. No, each child is different, and those assessments are very important for ascertaining the strengths and needs of the child. We're going to continue to empower parents with very rich, deep IEP content. Timmy, I have that there just as my favorite story of a young man who at the age of 12 had not had any kind of literacy instruction and was still in a severe classroom, basically learning how to color. Mom used our IEP content to advocate with the school, finally retained a lawyer, and now Timmy went to a special school to learn how to read, and I think he's 16 or 17 now, and he's reading at only a few years below grade level. So all of these things that we're putting together for you are really starting to make an impact in our community. I'll continue my work as a board member of the Council of Parent Attorneys and Advocates, speaking at those conferences and making sure that all the special education attorneys and advocates across the country know about our children. I'm continuing my work, working very closely with Perkins School for the Blind, especially their cortical vision impairment, cerebral vision impairment website and new school. I'm on their education committee, so I make sure, again, that our community is known to that population of therapists. And then this year, we hope to launch a new program, which we're going to call Education Navigators. And these will be peer supporters who will be trained in the IEP process after you take a very in-depth course online that you won't even be able to allow to access an Education Navigator until you've taken our course, which will be free for you, because this is all so complicated. And we found that when we did one-on-one IEP assistance, half of the time what we were really doing is training parents on the IEP process rather than providing them with sort of a guidance on that IEP itself. So we're changing this program around, and Audrey Vernick, who's our Director of Patient and Family Advocacy, will share that in an upcoming, in the next town hall. So what's next for research? Really, we're really looking to fund interventional research around education. Specifically, if a child after a big epilepsy surgery, especially really any epilepsy surgery, who's challenged with learning how to read, if they get intensive reading instruction, will they learn how to read? That's the research that we want to understand. Okay, improving the transition to adult life is the fourth child impact objective. I will just briefly say that we're working on content on health transition, and one of the things is making sure that doctors understand that our children need to be followed year after year to look for symptoms of things like hydrocephalus and early puberty. So that's what I'll be talking about at the American Epilepsy Society meeting workshop in December, is the need for long-term surveillance. I'm going to stop here because Audrey Vernick is going to discuss everything that we're doing around transitioning to adult life. That in and of itself is its own mini town hall. So that will be part 2 of our town hall. Thank you for joining me today. Happy birthday to the Brain Recovery Project. Thank you to all of you for supporting us, for believing in our children, for working with us, and for being really in our foxhole. We love serving our community, and we look forward to another 10 years with you. Our next town hall will be uploaded in the next few days. Thank you.